So PCOS and cardiovascular risk, it does increase your risk of developing cardiovascular disease at a younger age, like when you're 30s or 40s. And that's just from having the PCOS. You're more likely to develop cardiovascular disease in your 30s or 40s, but prevention definitely does work. And you definitely want to start thinking about it now if you already haven't, and you're an adult, because you want to start as early as you can to try to prevent developing risk factors like high cholesterol, diabetes, high blood pressure. As soon as there are any signs that you could be developing anything, you want to start working on that. And so the recommendations are the same as they would be for, women without PCOS. It's just that you need to start earlier because the PCOS increases your risk of developing cardiovascular disease earlier in your 30s and 40s versus somebody who didn't have PCOS, unfortunately. And so those things that would be, what you would think, definitely do not smoke. That increases your risk a lot. And then the second thing is, you need to be sleeping well. When you sleep poorly, it increases inflammation in your body, and that increases your risk of cardiovascular disease. The third thing is, stress management. Increased stress also increases inflammation and increases your blood pressure, and that can increase your risk of cardiovascular disease. The fourth thing is exercise, aerobic exercise, as well as strength training helps decrease your risk of cardiovascular disease. And the fifth thing is how you are eating. Definitely that's important as well. Eating a lot of fruits and vegetables, healthy proteins, and healthy carbs. I have seen some things about how people are trying keto diets to help improve their PCOS symptoms. You do want to watch the amount of saturated fat you're doing if you are or you're eating, if that is what you're doing, and you may want to get your cholesterol checked more frequently because you are at a higher risk for cardiovascular disease from the PCOS at an earlier age. And so you may want to, definitely you want to pay attention to how much saturated fat you're having, because that if you're having too much saturated fat, then that can also increase your risk of cardiovascular disease. And sometimes people try keto diet for their PCOS symptoms, which is also important, but you also want to watch your cardiovascular risk as well. So definitely prevention does work, and those being able to make those lifestyle changes will definitely help. And getting your blood work checked, your blood pressure checked every year to kind of monitor that you're not developing risk factors, or if there's any sign of prediabetes or a little bit of cholesterol abnormality, you can work on it right away. All of these things work, but you just have to be aware that you need to start doing them to prevent your risk of cardiovascular disease.